बिस्मिल्लाहिर्रहमानिर्रहीम, अस्सलाम वालेकुम। मैं हूं आपकी मेज़बान नादिया बशीर FM 102.2 रिफा रिहैब शो से। सामीन, आज हम बात करेंगे स्पीच साउंड डिसऑर्डर पर। ये एक ऐसी कंडीशन है जहां पे बच्चे स्ट्रगल करते हैं वर्ड्स को प्रोनाउंस करने में और उनकी साउंड जो होती है वो क्लियर नहीं होती और ये मुतासर करती है कि हाउ दे आर गोइंग टू बी एक्सप्रेसिंग देमसेल्व्स एंड हाउ दे इंटरैक्ट विद अदर पीपल इन द स्कूल and how they're going to be performing in school. To talk about such an important topic, we have with us Dr. Juliana Aminah Marhaban. She's a speech language pathologist and a lecturer at International Islamic University Malaysia. She has over 20 years of experience working with children that have speech, language, and hearing needs. She also specializes in oral rehabilitation, cochlear implant, auditory training, and inclusive communication. She has created Malay developmental scale that is for children between 0 to 48 months and program Latin auditory Malayalam that is a practical tool for language and listening development in a Malay context. She's also an author of children's storybook that nurture language and listening skills in young listeners. She's an active speaker, researcher, and a mentor. She's a passionate about empowering families as a key partner in communication. With her approachable nature and dedication, she continues to make communication more inclusive and accessible to others. Let's welcome her to our show and then we can formally begin our, we're asking her questions. Assalamu alaikum.
Waalaikumsalam warahmatullahi wabarakatuh. I am Juliana. You can call me Dr. Ju or Dr. Julia. It's okay.
Okay, thank you. I hope I pronounced some of the words, correctly when I was introducing you.
Yes. So, my father name is actually Marhaban, meaning selamat datang in Arab.
Mashallah.
The welcome.
Yes. Okay. So let's formally begin the show and let me ask you the questions.
Okay.
The first question that I would like to ask you is, I want you to define or explain what does the word speech sound disorder means, and especially for children and adults.
Okay, so our topic today is about speech sound disorder. Formally, we know that this is actually a speech production problem. It can be articulation or phonological problem. To understand this, first of all, I would like to explain first what is communication. So when we talk about communication, most of our communication, we are using speech. We talk to each other, we use speech. In order to produce speech, we need to understand first, we need to listen, hear, understand, perceive the meaning, and produce. In any way of this pathway, from hearing, listening, to perception, to understand, and produce, it can cause speech sound disorders. So speech sound disorders are common in children. So I can say from research, we can see that in preschool, it can be 8 to 9% of the children will have articulation or pronunciation problem. So, and this problem could result from only from behaviorals, meaning that it's actually a learned speech problem, okay, or it could be associated with other disorder. I will talk about that later, but what we could understand by the meaning of speech sound disorder is when the person, the child, it could be adult, children, any stage of life, to having a difficulty to pronounce certain sounds clearly or correctly. The person is unable to say it correctly, which make the speech is hard to be understand. Okay, so in normal milestone, the child sometimes they may produce unintelligible speech, but when this unintelligible is not, it's beyond the age of development, it could consider as speech sound disorder. So in a very simple words, we can say speech sound disorder is a pronunciation, how you say it, how the production of speech has distorted, has problem. Okay.
Okay, can you tell us the early signs and symptoms that parents should watch out for in their children's speech, during their children's speech development?
Okay, so I have do some reading, and we can see that in English we have 26 letters, and I've been told that in Pakistan your first language is English and also Urdu. So I've made some research, and I can see I found out that English have 26 letters. They have 44 phonemes, and while in Malay in my language, my Malay language is Malay, so we have about 26 letters. And Urdu, I found out that we have about 38 and 40 letters. So what we can see that in children, most of this sound should be developed or master or can be produced by the child. We can see in any languages, it can be Malay, English or Urdu, most of the sound should be mastered around 7 to 8 years. Okay, but when we see that 7 to 8 years, it's considered adult-like sounds. And I understand that in Urdu, you have quite a very fine sound. For example, you have like g, kha, is it? Right? So it's similar to Arabic. So this sound is quite, it's a very fine sound, meaning that you need more effort, more understand, more perception to produce the sound. For example, in English, they have the. Compared to is considered simple compared to the. Okay, because you need more effort in phonation and how you breathe it, how you put your articulators. Or before that, let me explain what is articulators. So articulators is your tongue, your lips, your air, all the this oromotor that control or how you put the sounds. Okay, in child, sometimes they made mistake or errors because the fine motor, the motor control, the oromotor is not a master yet. So they need to learn on how to put the articulators, the tongue, for example, on how to produce the sounds. So what we can see is it is normal for a child to say cat as tat. So they change from k to t for 3 years old. But it's not okay. It's not okay for 5 years old. So what we can see is, go back to the question again. What are the symptoms our parents should watch in the child? So I would like to list of the five red flags for the parents to see in your child. Okay, first, if the child's speech is not comparable to the child's age. For example, you can see that the child is 2 years old, and compared to other 2 years old, is not you're unable to compare it to other the similar age of the child. So 3 years old, 5 years old, 6 years old. As when you compare to other similar age of the child, you can see that the child's speech is not comparable, is not similar. Okay, that's first. Second, if the child has other medical condition that can lead to the speech sound disorder. For example, hearing infection, middle ear infection. A simple like middle ear infection can cause speech sound disorder. Third, if you follow the milestone, you can see that the child is not following milestone. As simple as we understand that child should start the sound, the production of sound from vocalization about from birth to 3 months. From birth to 3 months, the child should vocalize. So they should vocalize R, E, U, but throughout the years, from 3 months to 6 months, they should develop a babbles. So the sounds, the production of vowels should accidentally, or I can say that accidentally, change to consonants. So ma, ba, ma, and they should start babble at the 6 months onwards at until 9 to 12 months. So at 12 months, the child should start first word. So what happened in speech sound disorders, sometimes the child is not babble. They are not babble correctly, or the vocalization periods is prolonged. It's they should started babble at 6 to 7 months old, but they are not starting the babbling process. Okay, so that is another. The number 4 is that is 1, 2, 3, and the number 4 red flag is you can hear a sound distortion in the child speech. For example, you can say excessive breathing. Okay, for example, the child is mouth breather, say they excessive breathing. Okay, you can see that the child is nasality. You can hear so many sounds. The sound is nasal. It's hypernasal, or sometimes the sound is hyponasal. It's like you having flu. Okay, and you close your nose, and then this child sound is just something is incorrect, that you found out that is something that is not similar to other child. And lastly, if you found out there is articulated deficiency, for example, you can see hole or fistula at the soft palates, or at the hard palates, at the palates, or you can see that the tongue is tongue tie. Okay, this is quite controversial, but not all tongue tie will lead to speech sound problem, but there is some tongue tie that can lead to speech sound disorders. So just to repeat again, so 5 red flag is not following milestone, is there is any medical condition, there is not following, it's not comparable to same age. There is a distortion in production, and also the articulatory deficiency. So that's what the parents should focus and observe in their child.
Okay, very well explained about the different symptoms. So, can you further explain to us that how the speech sound disorders can be linked to other conditions, such as the hearing or loss or the developmental delays?
Okay, that's a very good question, Nadia. So sometimes we think that all problem or speech problem really relates to any co-occurrence problem, but that's very, very true, because the co-occurrence problem may lead to speech sounds problem. As the most common problem could be hearing problem, because as I mentioned before, that communication needs understanding, perception, and production. So if the child is having problem to listen or hear the actual sound, so most probably the sounds or the speech or the word that store that understand by the child is different from the actual source. Okay, so they may perceive it differently because of the hearing problem. So bear in mind that hearing problem can range from mild hearing loss up to profound hearing loss. So sometimes we can detect the problem from the severe and profound hearing loss, but not from the mild hearing loss. Okay, so mild hearing loss can cause from the middle ear problem or impacted wax, but because of the hearing the child has problem in hearing and certain sounds, that's therefore the child unable to produce it, because they cannot hear the exact sounds of the words. Okay, other than that, sometimes the child may born with a cleft, what we call as submucous cleft. Okay, that one is hearing. Second, I'm talking about cleft. This is the articulators deficiency. Okay, so cleft is something that maybe the structure, the oral motor structure is has problem, is not developed properly during pregnancy. We can see clearly if the child have lip or cleft palate, but there's another one cleft that that is not visible during birth. It's called a submucus. You can see that the palate is form is like a very nice form, but it's actually is no bony part. That's why it will make the child unable to produce certain words. Okay, that is a structural problem. Or other than that, it can cause the speech sound disorder can also caused by undetected diagnosis or underlying cause. For example, the child may have childhood apraxia, okay, childhood apraxia, dysarthria, or also um, other language impairment that can cause the speech sound problem. So first, yes, the child may have underlying problem that is undiagnosed during birth, okay. And second, if we found out the child is having normal hearing, no articulators problem, no understanding problem, yes, there's another type of speech sound disorder where the child is having learn SSD or learn speech sound disorder. Is a behavioral. So most probably the child have used to using that sounds. For example, sometimes we found out that the child is so cute saying certain sounds. Okay, so we prompt them, we reinforce the child to continue using the unaccepted speech actually, because we think that it's cute, and the child think that, oh, I don't have to follow adult like speech because I'm cute in the way I'm saying it. So yes, the child has no problem, but the child just like to use that style of speech. So it's not acceptable when, especially when they enter a school, they might get bullied or get teased by other child, because other child might find out this is not acceptable. So that's what we need to see among child.
Yeah.
Okay.
Very well explained, because in the clinics we do have a lot of parents coming in, and the child calls them like instead of saying the word water or pani, they call it a mum, and then continues the child continuously uses it, and then later it becomes a problem for them. Totally relate to
Yeah.
that answer that you have given them. Now I would want you to explain to the parents, when do you think is the right time to go and see a speech and language pathologist?
Okay, so this is very important. Okay, so first of all, I could not stress further that all children need hearing assessment. Okay, so when we talk about hearing assessment, the child need to be assessed immediately after birth. If you follow the recommendation on her hearing impairment, so the child need to be assessed and need to be detected around 24 hours of their birth, and then need to be diagnosed or start intervention about 3 months, and to 6 months they should start intervention. Okay, that's why, because in all research that if we can read online and anywhere, we can find out that if the child starts early, start assessment early, intervention early, the child is able or to follow the normal milestone. It's a higher chances, it's a potential for the child to follow the normal development. That's why it really needs to check the hearing first. Okay, so if you found out the child is no hearing loss, no further assessment needed for hearing, so what you can assess or observe in your child is always compare your child understanding and speech production with the similar age of their child. Okay, so if your, as I said just now, child should start vocalizing, say R, E, U, and continue with babbling. continue with first word and putting one word to another word and make it a sentence, two words combined, and then started to use 2-3 words up until 2 to 3 years. By 4 years old to 5 years old, the child should be able to converse, to able to tell a story. They can even tell a lie, tell a cynical, something like the non-literal meaning. Okay, so by 4 or 5 years old, the child should be able to use that. Okay, so what you should do is always monitor the child progress in any stage. You found out the child is not comparable to the similar age, you should immediately see the speech therapist. So what I'm saying now is there's no cut-off point. You should see the child, the speech therapist at 2 years old, 3 years old. No. Whenever you found out the child is not comparable to their age, see the speech therapist immediately. And by saying that, you need to always monitor the child's language. Okay, but of course, okay, one more sentence. Of
Go
course,
ahead.
you need to always monitor. What happens nowadays is we don't monitor our children. Okay, we are not realizing that the child is actually already delayed or are not saying it properly because we are not focusing on our child. So that's why I couldn't stress further that you need to focus on your child production, language, and understanding.
And sometimes, you know what happens is most of the parents think that it will go away, but it never goes away.
Yes, exactly. Yes.
And so you need to take your child, to go and see a professional as soon as possible, as soon as you detect or you're suspicious of the fact that he's not speaking clearly. So let me ask you the next question. So what?
Can I add one more?
Yes, please
about
go
that?
ahead. Yes.
Yes. Okay. Just like what you said just now, exactly. Because we in Malaysia as well, we still have parents who still has this stigma. They will think that the father is late talker, so my child will be late talker.
Yes.
That's one. Second, they will think that boy will be delayed compared to girl. No, there's no gender difference. Okay, either even boy or girl, they should speak following milestone. Say no gender differences, and also we think that okay the child is understand, they just don't want to say it because they are shy. That is not also the case. Okay, so if they're shy, they should shy with maybe with stranger, but not with family members. Okay, so with mother, father, or the sibling, they should be able to converse with their peers and their families. Okay, so these three things that we need to remember. That's a very good point, Nadia. That's a very good point.
Because we have the same thing, some of the children, they come to us in a very, at a very later stage after actually the schools pushes them to go and seek help, professional help. Then this is when they come. Otherwise, the same thing happens here. They're going through the same family dynamics, like the father was the late speaker, or the maternal uncle was the late speaker. So that is why they take after them, and then and another thing that's very common is that they think that if once they interact with the peers, when they will go to the school, things will automatically resolve. Once you go to the school, things don't automatically resolve. I think they get more complicated because of the academics and other things. So now I would like to ask you a question regarding the tools.
That's why we still have that problem as well. When all this problem is diagnosed or found out by the teachers, not by the parents. The teachers is the one who noticed that the child is having problem, not the parents. So I think that is still a common problem among our society nowadays.
Exactly. Yeah. So the next question that I would like to ask you is that what sort of assessment that or the protocols or the tools should an SLP use?
Okay, so for this question, I will explain it in a very simple explanation. So what I can see that when we do assessment, the first thing that we should do is we do observation. Okay, so observation is we need to look at the parents, the family way of conversation, because in certain speech sounds, we think that is a formal speech sounds, because for example in Malay we do have dialect, so different dialect, different speech sounds, different way of saying it. So we need to observe what is acceptable in the family dynamic. So what is actually being taught or being used by the family. So we need to observe that. Second, what we should do is, as a speech therapist, or maybe the parents, if you want to observe or assess your child, you should do the speech sampling. So we have two types of speech sampling. So actually, the first speech sampling we can do is connected speech sampling. We can have a conversation with child. We can have a very simple conversation. We can talk about what they like, the toys, the playing, the games, because we want to get the spontaneous sounds. Okay, what the unique about speech sound disorder is sometimes if by imitation, the child will be able to say it. But when it's spontaneous or automatic conversation, the child will unable to say it. That's why it's very crucial to do speech sampling in two methods. First, in connected speech sampling, in a very normal conversation, to see it how the child produce the sound or affected sounds automatically. And second, to target all phonemes in your language. For example, in as I said just now, in Urdu, in English, they have a list of phoneme, list of consonant, list of vowels. You do a single word sampling, means that you request the child to say one by one of the targeted phonemes. Okay, so you can have the targeted phonemes at initial sounds, medial sounds, and if your language has that consonant in final sound, you should also have a single word sampling at the final sound. So these three, and also you should test or should assess the sampling in non-word as well, not only the words, and to check if the child able to imitate in non-word or non-meaningful sound. For example, a very simple sound non-word is, for example, in Malay, we have ba, 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 pa, 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 or in English, ba, 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 bu, bu, pa, pa. So it's different. So we can see that maybe, for example, that I used just now, the child unable to say cat, the child say cat. So we check ka, 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 kaka, kakaka, ku, because we want to see in what context, in which context or which pattern the child is unable to produce it. Okay, because it will lead to next assessment that I'm going to explain. Based on all of this sampling, we will test the stimulability test. Okay, this stimulability test is when we test to see whether the child is able to produce it with imitation or with teaching. Okay, so because as I mentioned before, speech sound disorder can cause by underlying problem, or can cause it's just a learned problem. So stimulability test is very important to check if these sounds can be correct easily. Okay, so we do what we normally practice is we calculate the percentage, which sounds is how many sounds that this patient how many errors that this patient is making. Okay, for example, the child changed from k to t how many times, how many percentage, in what position, initial, medial, or finals. Okay, and when we found out and then we understand, okay, this is actually all of these sounds that the child unable to produce it, and this is a percentage of the sound that the patient is unable to produce it, and we found out that the context is, okay, the child will change from this sound to this sound. What happened? Oh, b to p, b to m, k to t. What sound is changed to what sounds? Then the last assessment that we should do is auditory discrimination test. Okay, remember I said just now that speech sound disorder can cause by hearing impact, but hearing impact is something that is something that you can test. But there's another understanding or auditory problem that is not based on the hearing result. It's the auditory understanding. So the processing, the understanding, they hear it differently. They change its sounds. That's why we need to do auditory discrimination tests. So we see if the child changed from k to t, so we check, do you perceive, do you hear it k or do you hear it t? Which one? Okay, so if the child said that, oh, I hear it k, but I produce it t, so definitely we know that it's not about hearing, it's about the production. That's why after you observe, you do speech sampling, you do simulability tests, you check the pattern, and you do the auditory discrimination test. So this is very crucial in speech sound disorder.
Okay. I would like you to now let us know, because most of the parents, they could do ask us when they bring the child in, that how long is it going to take for their child to get better and to be able to speak in a clear, with a clear speech. So what do you have to say for that?
Okay, I would say that in certain sound, especially the visual sound is like plosive or bilabial sound. So the sound that you can see it visually. For example, p, b, the child can easily see the sounds. This sound is easily can be treated or can be corrected. I have an experience that the child can be corrected within like 10 minutes, 20 minutes, okay, because it's a learn. But the question here is now is not how to correct it, how to maintain it, how to make sure that the child to consistently use the correct way of saying the words. Okay, to correct it, in certain sound, it can be corrected in the very, very short time. Okay, speech therapists can show you on how to put your tongue, your lips, and produce the sound correctly, and you can see that the child can produce it a very short time. But as I said just now, for example, in hearing impact child problem, in hearing impact in cleft palate, they need effort. They need effort to consistently use the correct sounds. Okay, so that's when the parents, the family plays the biggest role now. Okay, speech therapists can teach you how, but to maintain, to continue at home, and to make sure the child is successful and progressing, and make sure the child able to use it effectively, is the parents. You need to continue to monitor the child at home, to make sure the child is able to use it the correct way that already been taught by the speech therapist.
Okay, so due to the lack of time, I would love to continue having this conversation with you, but we're moving towards the end. So I would want you to give us what is the one or like the home take message for the people that are listening to this program today.
Okay, so what I can see that we as a parent, as a professional, and anybody, the community, the teachers, we play the biggest the role, the important roles in the child's speech language. Okay, so don't take anything for granted. That's the first thing. Okay, if you are not sure, reach for help. Ask. You may ask. We are very lucky nowadays because you can reach anyone, everyone by email, by social media. So reach, okay? Always compare. Okay, one thing that we must remember that there's help. There's lots of resources around us, okay? So don't take anything for granted because this problem may cost their life. It's not life-threatening, but it's a quality of life. How they perform as a better person, for example, in our religions, we need to learn on how to perform salat, to read Quran, because this speech sound is related to our religions and everything. So it's related to our life and everything. Okay. That's my
Thank you so much for joining us all the way from Malaysia. I would love to continue having this conversation with you. It was very fruitful, and it was, I really enjoyed having this conversation with you regarding speech and sound disorder. I hope you come and join us at Riphah International University in our speech and language department on different platforms to talk about the speech sound disorders and other disorders, especially the oral rehabilitation. Thank you once again for joining us.
No problem. Thank you so much. I don't know how to speak in your language, but thank you for inviting me, and I'm very honored to have this show with all of you. So you can just reach me by my email if you want to reach me. Thank you so much.
थैंक यू सामीन, जैसे कि आप सुन रहे थे स्पीच साउंड डिसऑर्डर के बारे में, जैसे ही मैं पेरेंट्स को जाने से पहले यही कहना चाहूंगी कि अपने बच्चों को जैसे ही आपको ये अलामात नजर आए, अपने बच्चों को प्रोफेशनल्स के पास लेके जाइए। अगले हफ्ते हम फिर मिलेंगे एक नए मौजू के साथ, एक नए टॉपिक, नए मेहमान के साथ। तब तक मुझे इजाजत दीजिए। अल्लाह आपका हामी और नासिर हो। अल्लाह हाफिज।